Hi guys, welcome to the new office in 5 Doc. Today we're going to talk about the Latarjet procedure, which is for shoulder dislocations or shoulder instability. This is what a scapula looks like, and or shoulder blade, and this particular bone here is called the coracoid process. The coracoid sticks anteriorly, and the Latarjet procedure is that we're going to cut the coracoid off, usually at its base back here, and we're going to bolt it on with 2 screws down here. That deepens the socket, just ignore those 5 holes, and by putting the coracoid, this, to the glenoid, this, it stops the shoulder from dislocating. That's a very good procedure for people who've had either bone loss or have had failed surgery in the past for whatever reason, or if they happen to be a contact athlete, for example, an NRL player, a rugby league, rugby union, AFL, high elite athletes would choose that as their first operation. But we'll talk about that in depth in the next video. Thanks.